Good morning. We are
Hello.
here today with Mr. Roger Elmer, our amazing functioning neurologist who is just helping people all over the valley. I put out a post and asked a couple, Doc and I converse privately to see what we're going to talk about for this week. And one of the topics that really popped up in my feed for what people want to discuss was mindfulness. So today we're going to talk about mindfulness. And I also want to talk about we're in this networking arena, meeting new people. So one of the tips that somebody had suggested was maybe tips to help people remember things. So I don't know if that's something you can help us with today, but so Dr. Elmer, discuss mindfulness and what mindfulness is. I think I stumped him.
Remember.
He has a temporary memory retrieval problem.
Yes, exactly. Nobody has a memory problem. It's always memory retrieval.
That's right.
The problem.
Temporary.
Yeah. Well, the ability to attend, the ability to function neurologically, to be able to think clearly, and that we tend to think of it as more in the frontal lobes. The movement system is the foundation of our circuitry that we think with. So we have to have a good movement system in order to be able to think, including the movement of our eyes. If I were to ask you, what did you have for breakfast 2 days ago? You say, how would you get there? And you watch, if you ever ask somebody, say, what did you have? And you'll see they'll go, yeah. They're using their eyes it's like a gear shifter to a different area of the brain so that they can access it. And so they're moving, and by moving, they're creating that ability. Now, Roger Sperry, who was the major guy who did all the research on split brain studies for you remember there were studies done on kids with seizures, and they cut the corpus callosum, and because of that, they made two people in one person. And that's where he was able to study what is a right side of the brain and what does it do, what is the left side of the brain and what does it do. And he did those studies. Well, back in 1952, he said that we used to think that thinking allowed us to plan and therefore move. He says it's completely the opposite. Movement allows for thinking.
Ooh, very interesting.
In neuroscience, the phrase that we use is movement, that thinking is movement turned inward. Just let that sit for a second here. You move, and then you can think. We're sitting looking we're in a museum looking at a painting. The same information is coming to us. You see on the painting, you say, look at that painting. You say, do you see the painting in the painting? And I said, I don't see it. What am I going to do in order to be able to see it? I'm going to start moving my eyes. I'm going to start moving my body. I might stand up and get a different perspective. Same information coming to my eyes. Hasn't changed, right? It's still coming. And you say, well, it's the perspective. That we tend to think that, but actually what we're doing is we're jacking up other areas of the brain, particularly those that are in the region of vision, in the visual cortex, and because it's running higher, I can see. It was running lower, so that area was, it wasn't starting up. Yours was running high enough that you saw it.
Yeah, it reminds me of some of our other conversations too about anxiety. It's all kind of goes to the same thing. So we had talked about, isn't the brain amazing? I've learned a lot. But like when we were talking about, it reminds me of the same conversation of like when somebody's anxious, if they get up and go do something else, it immediately is targeting another part of the brain. Mm-hmm. So when somebody is anxious, what part of the brain does anxiety come from?
Anxiety comes from those areas of the brain that are running at different frequencies. So it could be different areas. If my right frontal lobe is running low and my left is running high, I'm going to have angst because of the difference. The greater the difference, the greater the angst. Same thing with depression. The greater the difference, the more depressed one side is, the more depressed I'm going to experience. Depression I'm going to experience. What is the answer? Build that weak side up. What is the problem? Every time I get a problem, if I'm a left brainer, right? I'm a left brain person, and most guys are, right? We're very logical, and that we tend to strategize our solutions through our left brain. So when you give me a bigger problem, I'm going to use that left brain at a higher level. And here's the real issue. When I use one side of the brain, I'm inhibiting the other side. So I'm squashing the right, and that's the real problem. I'm not only pushing the left, I'm squashing the right, creating a greater degree of angst. The more difficult the stressor is, the more I'm creating that difference. That difference, the angst that I feel, the anxiety, is because of the difference. And so pushing that system that is weak, and that's not easy because you push it, that's half the problem. It's, can I make the other one inhibited? If I inhibit Arnold Schwarzenegger, if Pee Wee Herman's trying to inhibit Arnold Schwarzenegger, Arnold just laughs, right? Sometimes we have to literally chop Arnold off at the knees. This is some of the things that we do in our office are cold calorics. We're running cold water in an ear, and sometimes they're dizzy and lightheaded, nauseous, turn white, and sometimes even vomit, right? But it knocks it down so that when we push the other side, it can get ahead and start. It's the driving of the brain is one part. The harder part, in my experience, and in any issue, is the inhibition part. With a stroke, right? And what do we do traditionally? We're going to stretch it. Well, those muscles are already strong, and the nerves that drive them are already strong. And they're good at inhibiting the nerves that are over here. How do I deal with it? I'm doing exactly the opposite of what the therapists are doing. I'm playing with the weak side. And they say, well, doc, the next day I'm able to get it flat, after one little visit, right? And then it's back. I say, why is it back? It's because the inhibition part is the part I have to build up. I can get the muscles to be stronger. I can get the nerves to be stronger. But the part of the nerve that inhibits it, and to create that equal tone, you have equal tone, right? It's able to sit in this position. If these were strong, you'd be like that. And these were weak, you'd be like that.
Oh, that makes perfect sense.
And so I'm working with the nerves that are creating the tone back here and getting these to calm down, to shut up. So we get it to shut up, and then it's like a normal hand. It is a normal hand. It's the up here in the spinal cord and above that's having the problem. And so that's how we work with it. Well, same thing with angst. If I'm dealing with angst, I got to get that other side, that weak side, to be stronger, not only in its ability to drive, but it's in its ability to inhibit the other side. That's the real issue. And then when we talk about the brain, we're saying, oh, it's the brain that's got the problem. No. The brain is dependent upon the drive of the cerebellum. We talked about the cerebellum. I was the COO, Chief Operating Officer of the entire body, right? And it takes all the information in from all the categories, all the departments, right? And then gets things rolling, and then monitors in real time and makes sure that it's doing the right thing. Well, the cerebellum receives all the information and drives the opposite cortex. The left side receives the information and drives the right cortex. Its drive, when you get up in the morning, you stand up and gravity pulls down on you, the cerebellum is receiving that information and driving the brain. So if I've got an Olympic gymnast over on the right side, it's driving the left cortex like an Olympic gymnast, right? And if I've got a tumbler on this side, it's driving that much on the other side. So the secret is I go to bed, right? You go to Dr. Elmer's and he's driving that cortex and he's working it so that it's inhibiting properly. But then you go to bed and it goes down to the level of the drive of the cerebellum. So we've got to give the cerebellum skills so that it's now an Olympic gymnast. So that it's driving the right side like
it's like a piston.
Right side, yes.
It's like a piston. What would be some good exercises to build up your cerebellum?
What does it do for a living?
It thinks. It drives.
Well, the cerebellum is actually more about movement. Now, it creates the ability to think because thinking is movement turned inward.
So move it or lose it.
Move it or lose it.
Yeah.
Why do I have a weak right cerebellum? Or weak right brain? Because I have a weak left side of my body. And that is cerebellar. My cerebellum on the left is weak compared to the right. It's the skill level. And in fact, my favorite term in terms of the brain and cerebellum is they are refiners. They're refiners of movement. They're going to make sure that in fact, it's more of an inhibitory thing than it is an excitatory thing. It's going to make things, it's going to carve away unwanted activity, unwanted movement. It's going to make sure we're not just a total ball of spasms all the time. Because we would be. If we didn't have those systems, if it wasn't being inhibited all the time, we would be a ball of spasms. We wouldn't go anywhere. And then we'd die.
Yeah, that's why it's so important to do the left-right brain work. We've talked about that a lot, and that's why it's so key. So balancing is another good tip for left-right brain work. Dr. Elmer has talked about this before in other discussions about how the Asian community and the Jewish community have very little Parkinson's, dementia, Alzheimer's, because they do a lot of left brain work in their daily life. Brush your teeth with the opposite hand. Is one small way that you can do it. It's funny because when we do a video, I think everybody the next day is brushing their teeth with the opposite hand. But you talked about something else that a friend of mine, and I was going to tag her on this because you brought it up today. Her 19-year-old daughter just had a massive stroke. So why do people have strokes at this young age? What happens? What happens in the brain that causes them to have a stroke?
There are multiple factors that can be involved, and oftentimes they're stacked up on top of each other. You take a person who gets migraine headaches. If they get migraine headaches on a regular basis, they are beating the crap out of their blood vessels, particularly in the brain itself. The brain itself doesn't necessarily have the same blood pressure going on as the rest of your body. You could have a normal pressure inside of your body and have high blood pressure inside the brain. And we actually look at the inside of the eye is a better indicator. When we're looking at the retina and the blood vessels on the back of the retina, the shape of the blood vessels in the back of the retina are a better indicator of what is the blood pressure inside your head doing. And that, in fact, I got a picture on the wall of that where it shows that the blood vessels should be the same size. Now, if you talk to a regular medical doctor, they're going to say, no, it should be like 1.5 to 1. Say, no, that's just because we're all screwed up. Just because it's common doesn't mean it's normal. So, but it should be the same size. Now, the artery is a high pressure hose, and we dictate through the nervous system the pressure that's going through it at any given time through the autonomic nervous system. And that nervous system, if it starts to clamp down too much, that artery gets smaller. Well, it creates with that, beyond the capillaries, the blood vessel beyond it is the vein. The vein has a very, very thin wall of muscle, and it bloats, it gets bigger. And because it gets bigger and the artery gets smaller, there's a big difference between the two. And that's what we're looking for. That's, in fact, if you want me to, I'll grab it. I'll grab the picture.
Okay, he's going to grab a picture really quick. So I hope you guys are getting value from Dr. Elmer in our videos. If there's anything that you want to discuss, please comment about anything that you want to discuss. We're always looking for topics. We want to make sure that the audience is getting what they want. But I have to say, in all honesty, the real power and the real magic that comes is when you come to the classes on Wednesday night. That's where the magic happens. I've seen miracles performed in this office with that. This is a funny picture because I know what's wrong with this photo, which is kind of funny. But go ahead, because I learned in another class.
Okay, so here's a retina, the back, the back of the eyeball there, and we're looking here at, this is a vein and this is an artery, and they should be the same size. And what's really funny about this picture is I got this picture out of an example. I have a thing called a panoptic, which allows me to see and even take pictures of the back of the eye, the retina. And in this picture, they think this is normal.
That's what's funny.
I'm sorry. Did I laugh out loud? Right. So it is clearly not. This is a vein, and it's bigger than it should be compared to the other one. What we're getting here is, imagine if I have my buddy's a clown, and he makes the wiener dogs. He takes a balloon and blows it up, and he makes a wiener dog out of it. Well, imagine if I took one of those balloons and before I blow it up, I put my ring in it, and then I blow the balloon up, and the ring's in the middle. And if I were to take that balloon and put an A on one side and a B on the other side, A for artery, V for vein, and I were to take that on the artery side, the A side, squeeze it. Now, we got an artery, vein, and then the ring represents the capillaries, which is where this is where the magic happens, right? That's where the exchange of oxygen, carbon dioxide, nutrients, waste products, that's where it all takes place, right? So I'm going to squeeze the artery, and it's going to get smaller, and the vein is going to bloat. It's going to get bigger, bloat. All right, and that's the example. Well, that's what's happening. This is called venous ballottement. This is actual high blood pressure in the brain. Not good.
Is that an indicator of a stroke when the blood pressure?
No, that's a piece of information that says potentially I could wind up with a problem. Well, let's talk about. Let's say we have migraine headaches along with it, that on a regular basis they're beating the blood vessel up, and then let's add female birth control to the equation, which makes it more fragile. Let's add aspirin to that. It makes it more fragile. Now I'm calculating. Whoa! It's not if, it's when I have.
Wow!
A stroke,
right? That's because when you, as a female, going through getting birth control, that's one of the that's a precaution on there. Mm-hmm. But it's sad. We look at these precautions and we still don't take them seriously enough. So having somebody that's, say, 19 years old, if she's on birth control, if she's taken, that just opened my eyes big time.
And you just got to decide. I mean, I decided a long time ago, I'm just not going to get pregnant.
Yeah. He's a comedian too, on a side job. He plays a Tropicana on Saturday nights.
Thing worked out because my comedy career tanked.
Yeah, exactly. So I'm going to wrap it up here with Dr. Elmer today. Go ahead.
Would you like me to show you real quickly?
Okay,
I was just going to draw. We were talking about the role of thinking, the role of memory, and all of that. And when we look, see, it's right about there.
Yeah, I can get you higher.
This is the left side of the brain. We're just going to do the left side of the brain real quick. Here's the frontal lobe, and when we take that frontal lobe, we look at it. Here's the left frontal lobe here. We're looking at it here. We take this apart. Here's the left on the inside. Okay, the outside. This is the frontal lobe. Behind this, you got three noodles. I call them noodles here. Three noodles, three noodles, three noodles, three noodles, and then you got two. They're called gyri. This is where we feel our body. This is where we move our body. Okay, and so that is right here, that noodle, and here's the other noodle. So this is Brodmann's area 4. This is where we move our body. This is 3, 3, 1, 2. we call them the primary motor cortex, primary sensory cortex. And then we got the 3 noodles out here, 1, 2, 3. But this is the area we move from. Occipital lobe, frontal lobe. This is parietal lobe, occipital, temporal. Okay. So why am I diagramming this? All the information comes in your hearing, your tasting, your vision, and it goes into an area called the association cortex in the parietal lobe, in the upper part of the parietal lobe. That information gets shifted to the premotor cortex right here. It's going to tell you, where am I in my world? So it's going to take my world and my inner world and put them together right in here. And we're going to send that information here. Why do we need to do it? If I want to move my arm, what do I need to know? Where am I in my world? And like, let's say I want to move, but you're in the way. Right. I'm gonna have to move differently, right? Let's say my arm's over here, it's going to be different than if it's over here, right? And so all that information, if I decide I want to move that arm, the arm movement is going to happen from here. But the actual correlating it with with relation to my world is going to come from here. So those two have to work together. Then I have an area called the supplementary motor area. That's going to stabilize me, because if I lift my arm, I could fall over, right? And so it's going to stabilize me. Why am I going through all of this? Because this is stuff I think with. This is stuff I postulate or come up with ideas. It's also my primary memory area. The RAM on your computer. This is the RAM on your computer.
That's exactly what I was thinking, because it is definitely the computer, for sure.
It is, and it's the RAM. The RAM dictates what you can do in terms of memory, right? The secondary memory is right here, and then the long-term memory, what we call it the hippocampus, is right here. And if we do stuff a lot, think a lot, repetition gets it into the short-term memory, and then more repetition gets it into the long-term memory. But it's dictated by this area, our ability to think and to remember. The biggest part of this area, it's all about movement, remember? Yeah. The biggest part is about stabilization, and that's the thing we neglect. It's about, can I stabilize? And that's where balance comes in. I talk to patients, they're in their 60s, 70s, 80s. They say, I'm losing my memory. I need you to move. I do move. I walk. I walk once a day. That's nice. You need to make it difficult. You have to challenge your balance system. Yeah. I want stabilization. That's the biggest bang for the buck. Stabilization is how I'm going to do it. Now, to make your own balance gym, you're going to take a walker that you're never going to use as a walker. And we're stressing that too. He stresses that all the time. Got to get out of that crap, right? We're going to take that walker and back it into a corner. Now I have a balanced cage. If I fall backwards, I fall into the wall. If I fall forward, I've got my cage. I can use the cage and I get it to the level that I need, which is right at the level of my hands, right? I can balance on, barefoot. I can put a pad there. I can put a rocker board. I mean, there's any number of possibilities. The sky's the limit on the kinds of things that I can challenge it with, but it needs to be a daily thing. What I always say is anybody over 40 needs a muscle building program. Why? Okay, it keeps you younger, but also it's the major player in sending signals to your brain, keeping your brain running at a higher level. As the body starts to degrade and you start to shrink, it's because you're losing muscle mass and bone mass, right? We're getting thinner in our skin suit. Right. Yeah. That's where all the baggy and the hanging stuff comes from, right? So we're going to build the muscle up, and then anybody over 50 needs to have a regular daily balance program. Yes. Fortunately, you guys haven't gotten there. I've been there for a while. I'm 50 now, Doc.
I'm 50 now. It's balance work.
You got to let it ride. Okay?
You got to let it ride.
Just let it ride, right?
But it all goes back.
I set it up for you.
Yeah, exactly. So this all goes back to like what we've talked about before. So if you're doing the right brain balancing work and the toning, then the muscle retrieval problem, or excuse me, memory retrieval problem will get better.
It will improve.
It will improve. So keep up, doing those exercises. That's the one thing I know that I need to build up muscle tone, because I'm tiny and I know I need to build up that muscle tone. But more importantly, right now, I'm really working on the trying to do the more balancing work, because it's so important. And so doing all this exercises, maybe some of these parts of the brain that you let suppress for a little while, they need to be reawakened. Yeah. Is that correct?
Yeah. And maybe next time we could talk about the kinds of exercises that are going to put,
yes,
that are particularly, I'm the most interested in exercises that affect the involuntary nervous system, that affect the part that you don't think with, the part that's stabilizing you. Too often we go to the gym or we go to a physical therapist. These guys are great at the voluntary system, but they're not working the part of the system that tightens things down. Whenever we're gonna move, we have what we call spurt movers. The bicep is a spurt mover. So if I go to move it, it's going to make it happen. But if I don't have stabilization in that joint, I will dislocate that joint.
Gotcha.
And so we have muscles that are closer. They're not spurt movers, they're shunt stabilizers. We need activity in the shunt stabilizers, because the stabilizer system here is going to engage those ahead of the actual spurt movement. We got 40 times more impulses that come from the brain if I'm going to move that arm that are going to be there before I actually engage the bicep. That has to happen. Otherwise, I'm grinding that joint into powder. Why do you think we've got so many hips and knees? Boy, how did they survive in the Old West? I mean,
yeah,
they didn't sit. Yeah, their butts were moving all the time. And I say butts, yes, their butts were moving.
Yeah.
And that created all kinds of activity in the midline, and engaging and stabilizing, and therefore, because it stabilized, the hips could stabilize, then the knees could stabilize, then the ankles could stabilize. And so they didn't have that problem of grinding their joints into powder, because the nervous system isn't shunting anymore.
Interesting. So again, it all goes back to movement, like we've talked about many of times. Dr. Elmer and I brought a guest with me today, and we got into a conversation with the guest. I think I put it in here what we're going to talk about it, but we're going to talk about it next time, the spinal fusion, because I hear that term all the time. I have another friend who her husband, they want to do his. And so,
well, I have a phrase, and it's, when all you got is a hammer, every problem looks like a nail. And when all you got is a screwdriver, somebody's getting screwed.
Oh, so. I like that. And we're going to end on that note, because I like that. I don't know if Doc and I are going to do one more video before the end of the year. We have got to discuss that. Things are just